Welcome to this week's edition of Arkansas Money Talk, brought to you by the team at Retire Path Wealth. I'm your host, Kristen Oakley, and in the studio with me today is Dale Colclaser, who is the president of Wealth Management, and Mark Smalling, president of Insurance Management. Friends, it's good to be back with you. How are you doing?
Wonderful today.
Great to be back here, Kristen.
Well, I know we have more great information to share with our viewers at home, and one of the things that really sets your firm apart is your dedication to helping folks with Medicare planning that not everybody does. And Medicare is such an important subject. A lot of people, they're approaching that big birthday, age 65, right?
Right.
So, gosh, take it away. Where do you want to start today with Medicare?
Well, people are there's a lot of people turning 65 every day. I think over 10,000
Americans alone every day, right? Yep.
Every day. So, so you've got people think, okay, I'm turning 65. What do I do now?
Right.
And there's a lot more people that are working past age 65, or there's people that qualify for Medicare because of disability.
Sure.
Because, if you're disabled and you've been disabled and receiving benefits for 24 months, in the 25th month, you become eligible. And in some circumstances, if you have ALS and a couple of other conditions, you can actually become disabled much earlier and you become eligible much earlier. Right. For Medicare. So there's, and then it's what do you do? Because people hear about all of these penalties that are associated with not signing up.
Right, and if you don't enroll by the right times, that was going to be my next question is when does a person enroll?
Right. Well, most people think about your initial enrollment period, which is when most people did enroll in Medicare. In fact, Medicare, until about 10 years ago, would enroll you in Medicare. When you turned 65, you get a card in the mail. If you didn't want it, you actually had to sign the back of it and send it back saying that you didn't want it. So that's, so the initial enrollment period is the 3 months before your 65th birthday, the month of, and the 3 months after.
So that's 7 months, right? A 7-month window. Yeah.
Yes. And so that's the initial enrollment period. And then there are periods that are associated with leaving work and things like that. But a lot of people that are currently working are covered by group health coverage.
Right, they still have their employer health sponsored plan, right?
Yep. And so we get questions about that, most every day. We get somebody calling our office asking about that because we work with some employer groups, and those are questions that HR can't really answer, and so we get people calling us about those. For sure. Well,
there's no shortage of a need for this information with over 10,000 Americans turning 65 every single day here in our country. And the marketing machine starts, right?
Oh, wow.
People start getting these. It's like they know when your birthday is coming and you want to feel the love, but it's a little overwhelming at times, right?
One of the gifts we used to give out to all of our clients that were about 64 years old was, one of your traditional marketing bags where you would go and a vendor would hand you out a bag when you're at the state fair to put things in, and we just simply tell them, says, here, this is where you collect all the items you start getting, because one of the most requested mail lists is a turning 64 mail list. And so they just get inundated with marketing materials. And they said, well, what do I do with all this? So you put it in the bag and then bring it in. And then the reality of it is we're going to sit down and help you discuss your situation. We'll shred all that for you and help you walk through what opportunities are available that are best for you.
Because it can be very overwhelming and there's a lot of misinformation out there. So how does one go about enrolling in Medicare the right way?
Well, that's a great question. And because people are working and they're working past age 65, if you've missed the initial enrollment period, there are some rules around it. I mean, you have to apply through the Social Security office is where you apply for your benefits.
Okay.
If you have an account set up with Social Security, some of the stuff you can do online. But if you've been working and covered by group health coverage, there's some special forms that need to be filled out by your employer. And if you don't send all those forms in together, oftentimes it delays the process. And we want to make sure. So we help people not only apply for the Part B on their own, but also help put employer forms together because there are a lot of HR departments that don't get those across their desk every day and may not know exactly how to fill them out. So we try to make it as easy on everyone as possible when we're doing that. But people are worried about penalties because they hear about this Part B penalty, which is 10% per year for each year you don't sign up. And so they're concerned. They feel like they need to sign up because everyone around them is telling them to sign up.
Right. It's pressure from all sides, right? It's what their friends are doing. It's what the mailers are telling them to do.
That's exactly right.
Yeah.
Well, and again, just like with a lot of information we've talked about on many other topics, is so many times they think this is just the way this has to happen, as opposed to, hey, how does this actually work in my situation?
Right.
And part of helping them build a retire path is we can help them understand the right time schedule for them to begin to apply for these benefits.
To enroll, because it's individual and unique based on their situation.
That is correct.
Right.
Well, gosh, talk to me about the Medicare soup. That is I've heard that phrase, right? There's a lot of alphabet soup.
Of
Yes.
Medicare, right?
So walk us through that so folks have a clear understanding of what we're talking about.
Right. So when we're talking about Medicare, we're talking about original Medicare. That's your Part A and Part B. Part A is hospitalization coverage. Part B are doctor services, outpatient services. And then you have C, which came into being almost 20 years ago. That's your Medicare Advantage plan, along with Part D, which are your prescription drug plans.
Right.
And so, all of those, are different parts. And some of them, Part A and Part B, everyone has to have in order to pick up a supplement, because that's another one. And then when you look at supplements, there are more letters involved.
It goes
in
on
that.
and on, right?
It goes on and on. And so people come in and they go, well, I've got this and this, but why are there two Bs? And why is I don't understand this. And it seems like they could have come up with a better way of doing it than all of those.
But like a lot of things the government comes up with, it can be quite complicated and confusing, right?
It can be.
Yeah, we appreciate the necessity of having a job.
For sure, yes. Well, I love that you even shred all the junk mail that comes in for people, right? You say, just sort through it. Then you don't need to pay attention to this. Just focus on that.
That's right.
Yeah,
that's right.
For sure. Well, if someone's watching today and they are either nearing 65, turning 65, maybe they have a loved one who's in that situation, what would the process look like for them if they needed help specifically with figuring out this piece of their retirement plan?
Well, what we'd like to invite people to do is actually schedule a time to come in. We actually go through a Medicare questionnaire. Everything we do in our office is a planning process. So we go through a process where we're asking about your doctors and your prescription drugs. And then we work this into your entire Retire Path plan, because your budget comes into play too. If there are plans that don't meet your budget, that doesn't make it a good plan for you. So we really invite you to come into our office and call this number, 866-724-3893, and schedule a time to come in and meet with us. We'd love to show you how this works into your overall financial planning.
Mark, Dale, thank you so much. To our viewers at home, we are going to take a quick commercial break, but we encourage you, pick up the phone, make this important phone call to be able to get started with your own Discover Your Retire Path written plan. And as part of that written plan, of course, Dale and Mark are going to walk you through all things Medicare related so that you can make the best decision for you. Simply call the number on the bottom of your screen, 866-724-3893. You're also welcome to take out your smartphone. Simply scan that QR code in the bottom right-hand corner of the screen. That will take you over to a landing page, ask you a few simple questions, and a member of the Retire Path Wealth team will reach out to you to schedule your complimentary meeting to be able to come in and meet with Dale and Mark. When we come back, we're going to be tackling more things regarding Medicare, including costs and how do you actually enroll. Stay with us.
As a good saver, you've been putting away money during your working years. Studies find that the biggest fear of retirees is running out of money. Market volatility isn't just the downward movement of stock prices, it's the size and frequency of change. The more dramatic the ups and downs, the higher the volatility. This can put savers who are newly retired or a few years away from being retired at greater risk. Today's generation of retirees is not receiving traditional pensions as our parents or grandparents did. Instead, we have retirement accounts such as 401ks or 403bs. These accounts typically expose your money to market risk. The last thing you want right before retirement is to lose a portion of the money you need for income. But how do you turn these accounts into a retirement income? Is it safe to keep all your retirement money sitting in the stock market? The last thing you want is to lose a portion of the money you need for income due to market loss. By working with a financial professional, you can learn how to turn a portion of your savings into an income stream for life and income for the life of your spouse if you're married. We all have moments in our lives when we wish we had taken action sooner. Don't let procrastination reign on your retirement parade. Act now before it's too late. Please call our office to set up your no-cost, no-obligation retirement income review today.
Well, welcome back to Arkansas Money Talk. I'm Kristen Oakley here with Dale Colclaser and Mark Smalling from Retire Path Wealth. We are talking today all about taking the mayhem out of Medicare, trying to make Medicare easy for you at home. It's such a complicated subject. Oh my goodness, so many things to know as we've already unpacked so far in the show. But let's start with the costs. How much does Medicare cost, and how do you help folks navigate those costs?
Well, with Medicare and original Medicare, there are costs associated with that. Part A is free for most folks, but what people don't realize is if you haven't paid in to the system for 40 quarters, it could actually cost you, and it's actually hundreds of dollars a month for Part A if you haven't paid in to that or your spouse hasn't.
Right.
But Part B does have a cost for everyone, and there's a base rate. And then depending on what your income has been, and they look back 2 years. So for 2023, we're using 2021 tax returns. They look at that tax return and they look at what your modified adjusted gross income is, and that's how they determine what your premium is. So you could be paying a much higher premium, especially if you've just retired and you may have been in your higher earning years. It's interesting. You get a letter saying this is what your premium is, and then right behind it is followed up by another letter saying, oh, sorry, you made too much money. This is actually what your premium is.
And is that how IRMA comes into play?
That's
so,
IRMA.
Yeah, unpack that acronym, because I know I hear that a lot.
Okay, so that's income-related Medicare adjustment amount is what that is, what that stands for. You know, they've got to come up with a mouthful.
More alphabet soup.
And so many times it comes about by accident. You know, people get to the end of their lives and they have this plan. Well, the first thing I want to do is pay off my home, or I want to do this when I retire. I'm going to have these plans.
Right.
And so where it comes back to, as we've mentioned so many times before, about having the written income plan in place to know what the effect of our income is going to have on us on our whole scenario, which again is one of the reasons we believe it's so important that through our retirement income planning process that we focus on Medicare and Social Security and all of the other pieces that come in, as opposed to farming those out to someone else that's all they know.
Right.
And so they don't know the changes. I mean, so many times we've had the scenario come in that, well, I just got my taxes completed and my CPA said, this is what my outcome was. And it was just a simple adjustment by being able to bring income down by a small amount that helps to reduce those things. And that so many people don't understand that there's also ways to circumvent some of those adjustments that have come by simply appealing to the system. You just have to know the process for doing it.
Right. Gosh, so much comes into this. And we say this all the time. This is what you specialize in, that comprehensive, holistic financial planning.
Correct.
You have to look at all of these pieces. And of course, Medicare is an important part of that, but it can have ramifications on the other areas of your financial life.
It absolutely can. I mean, that's what we say all the time, is that you don't need to make any one of these decisions in a vacuum. And people just don't think
you can't
about
afford to.
You can't
right?
afford to.
No, for sure.
You can't, and it makes a huge difference in someone's. And we're talking about paying more in premiums. There's also premiums for supplements if you decide to go the supplement route.
Yes, that was going to be my next question. So go for that.
And so they can vary widely from company to company, and they are standardized by Medicare to make it easier. As part of the alphabet soup we were talking about earlier. If you look at one plan F in one company or one plan G, they have the same basic benefits, but some companies offer additional benefits tied to those that might make them more advantageous than others if you actually use those. And then Part D, your standalone prescription drug plans, those have costs too. And Part C, some of them are zero premium, some of them have premiums attached to them. So all of those things come into play. But in order to enroll in a supplement or an Advantage plan, you must first be enrolled in Part A and Part B.
Right.
Part D, the prescription drug, you only have to be enrolled into Part A in order to qualify for that. But
gosh, it's like, okay, if this, then that, right?
That's exactly right.
Well, and not only that, it's so interesting to me that how many times people will come in and say, well, my mom had this plan. I just want what she had because that worked great for her.
Right.
Yeah. But again, without, it might not necessarily be what's right for them.
That's exactly
right?
correct. Without knowing their personal situation with the prescriptions and the pharmacy and the doctors that they utilize.
Because not to even make it more complicated, but I know with Part D, there's different tiers. So it really depends on what kind of medications you're on. Do you have the brand name? I mean, there's just so much goes into that.
That's correct. I mean, there's so much that goes into it. And a story, a couple of years ago, we work a lot with a hospital group. And so we had a nurse that was retiring. Her husband was a retired attorney. And he'd spent 6 months looking at all this stuff because she was getting ready to retire. And so she'd called me and I'd done hers, but he'd already figured out all
what needed to happen, right?
What needed to happen.
Yep.
So this was at the beginning of COVID. I went over to their house to do it. I don't make house calls usually. This was a specific situation, but went over and sat down and in about 30 minutes determined that what he was getting ready to do was going to cost him a lot more money out of pocket. And he said, I spent 6 months doing this and you figured this out in 30 minutes and saved me hundreds of dollars every year.
But this is your expertise. I mean, this is something that you specialize in and you focus on, and not everyone has the time or the ability to even know. You don't know what you don't know, right?
Exactly.
And so you were able to succinctly look at a situation and be able to do that so efficiently.
Right.
Well, and not only that, we're completely carrier agnostic. We don't care who you choose to utilize or what plan works best for you. We try to license with every opportunity that's available.
For sure.
So we can just help align people with the best option for their specific needs.
Absolutely. Well, there's so much to wade through. So when you're helping someone discover, okay, what plan is right for them, what are some of the things that you're looking at specifically?
Well, we're looking at their usage, the doctors they go to, and how often they go see doctors or specialists. So when we're looking at plans, we want to make sure that their doctors are in the plan. It's no good if we sign them up with a plan and they've got to go find all new doctors.
Right.
People don't like change. People that are in retirement like change even less than most.
Yes.
And so we want to look at that. Their prescription drugs are a huge driver of which plans are best for them.
Right.
I mean, it's just, the cost of them. You only have to look at all of the TV ads for drugs that are out there that they're telling you to go to your doctor and tell them you need this every day. Well, those drugs are expensive. Somebody's got to be paying for the advertising.
Absolutely.
And so you look at those things, and then their budget comes into play. And it's different for each person. I mean, we have many couples that are on different plans. Oftentimes they come in and say, I want the same plan, but that's not in your best interest. We're always looking for efficiencies and ways to save.
Right. So important to look at all things. And I know that some of them plans cover things like dental insurance, others don't, right? So people could unknowingly be without the kind of coverage that they actually need.
Absolutely. Absolutely.
Well, if someone's watching today and they're going, gosh, this is really good information. I need to come in and meet with you guys and sort this Medicare mess out. What would you want to say to them?
Well, I would say if you'd like to figure out what's best for you and how to navigate this difficult topic of Medicare, we would love for you to call the number on the screen and come in and schedule a time to meet with us. As Dale was mentioning earlier, we're contracted with most carriers, so we're trying to find what plan's best for you. We believe we're a fiduciary in everything that we do and trying to find the best solution for your particular situation.
Mark, Dale, thank you so much. To our viewers at home, we are going to take a quick commercial break, but we encourage you, pick up the phone, call the number on the bottom of your screen, 866-724-3893. This will get you the opportunity to come in and meet with Dale and Mark and discuss all aspects of your financial plan for retirement, and specifically Medicare as well, and how that fits in and what would be the right plans for you. This is for no cost, no charge, no obligation. It's simply an invitation to have a conversation to see how they can help and serve you. We have more, so stay with us.
When was the last time you saw your financial professional? Are you getting the most out of the strategy that was created for you? Although you've done a great job finding someone to help plan for your future, are you 100% sure that you were given the right strategy? We can help answer these questions and more with a complimentary second opinion evaluation. We will take a look at what you have in place and then help determine if you're well positioned to get the most out of your future retirement income. In the event that it is not, we can help by making suggestions and showing you how to get on the right path. You wouldn't get just one opinion when it comes to a major health decision. So why would you treat your most important financial decision with such disregard? Call today for your no-cost, no-obligation second opinion evaluation to see if you're getting the most out of your retirement income plan.
Welcome back to Arkansas Money Talk. I'm Kristen Oakley here with Dale Colclasure, wow, sorry, tongue twister, and Mark Smalling of Retire Path Wealth. We're having a great show today, diving deeply into all things Medicare as it relates to your overall financial plan in retirement. My next question for you guys, if someone is watching today and maybe they've already enrolled in Medicare, but they're not really happy with the option, the plan, their premiums are going up, what can be done about that?
Well, there are things that can be done. If somebody's on a supplement currently and they've seen their premiums going up, if you're still in good health, there's a possibility that you could actually enroll in with another carrier or with another plan and actually save some money. That's possible. But you would have to go through medical underwriting at that point. There also is an annual enrollment period, which is every year between October 15th and December 7th, where you can make changes to your plan. So you can make changes to your drug plans, a Medicare Advantage plan, enroll in a Medicare Advantage plan if you've never been in one of those before. It's that's a time to do that.
Right.
But there's also people that have special enrollment periods based on certain situations. We mentioned leaving employer coverage. That's a special enrollment period because people oftentimes go ahead and enroll in Medicare even while they're still working. But you don't need to do that if you're involved in a group medical plan that's 20 or more people.
Right.
Medicare is always going to be secondary to your group plan. So there's really, in most cases, no reason for you to have that unless it's more cost effective to enroll in Medicare. But there's also if you move out of coverage area. So if you're moving to a new state or you're moving out of a county where your Medicare Advantage plan or Part D plan was effective in that county, but it's not in the new one, then you have a special enrollment period and you need to make those changes. You only have 62 days to make those.
I love the specificity of that, right? 62.
Well,
right?
Yeah.
Another fun rule, right?
Another fun rule.
Yeah.
There are all these specificities to everything you do with Medicare and the timing of when you do them. Because, as we mentioned before, we like to be efficient. We don't think people need to have double coverages. We've even seen people with triple coverage that have come through the office where they're actually covered by their employer plan, their spouse's employer plan, and Medicare.
And paying unnecessarily.
We had a couple in just in the last couple of months that came in and had all of this different coverages, and they were wondering how they could save money on this. And I said, well, here's about $1,000 a month right here.
Wow, that's amazing.
I mean, you just people don't think about it. They just think they think more's better.
Yeah, we're back to the more's better.
Right. Well, and there's a lot of misinformation out there, and I know you were sharing with me too, Dale, that a lot of folks will go to Medicare.gov, and all it does is confuse the heck out of them, and so then they come to you and say, "What do I need to do about this?" Right?
Right. Yeah, they'll go in and get information, and they'll assume that they understand exactly what they're talking about because I'm this age or I'm this category, or I was given this information in this work for my friend or my coworker or my relative, when really that just doesn't fit their particular situation.
Right, because as we say so often, it's not a cookie cutter approach. That's not what you all do. You're not just going to say, you fit into this category, therefore this is the plan for you. There's so many personal factors that far outweigh all of that.
Right. The reality is if I need the coverage, I'm 65, I'm eligible, and so then where do we go from that next step? Not just, hey, let me flip some switches on and see what happens, but let's actually get in the right place.
For sure. Now, what if someone wants to retire sooner and they haven't hit Medicare age yet? Do you help folks navigate that as well?
We do. That's a great question. We do work through the ACA, Affordable Care Act plans. We do have those available, and we help people with that because oftentimes you have someone that's retiring and they're Medicare eligible, but their spouse is not. And they may have COBRA available, but that may just be for 18 months.
Right.
And so what do you do after that? And so we help people navigate that situation too and help them figure it out. But we think it's important to compare things because oftentimes people just don't. They if you're turning age 65 and you're still working, but you want to see what it would look like if you went on Medicare instead of your group health coverage, because that's your choice. I mean, when you're eligible, that's your choice. If you'd like to do that, we can help you look at that in black and white, because as Dell often likes to say, we don't like to guess.
Right. No.
We're gonna run analysis on the cost of doing it both ways and figure out what's the most cost-effective way for you to do it.
Right, because
your
we believe
situation.
our job is to provide people with the information and
Yes.
allow them to make the best decision that suits them.
For sure. Well, one thing I'm curious about is, all the research shows that women tend to outlive men, right? So in a married couple, let's say that the husband passes away first, what does that potentially do to the wife's Medicare premiums, because now she's in a higher tax bracket? Does that affect how much she's going to have to pay for her own coverage?
It absolutely could. I mean, if she could end up with the income-related adjustments we were mentioning earlier, just because her income is above the single threshold, and they had more room when they were married couple.
Even though it's only just stayed the same.
Yeah.
Yes. Yeah. And so people can be hit with higher premiums and go, wait a second, what's going on here, right?
Right. And we've seen situations, we even had this, and this had to do with Social Security, because of the Social Security cost of living adjustments were so large this year that we saw people having to pay additional taxes. And we really view the income-related adjustments as just an additional tax anyway. But you can end up in those thresholds. And we had a client a few years ago that we didn't know went back to a part-time job. Ended up, her accountant said, "Oh, this is what where you are, and you're going to have income-related adjustments this year." And she called us and said, "How do you fix that?" And we're like, "Well, you have earned income. You could actually make an IRA contribution and
So
take
smart.
you down below that level."
Threshold, right? Gosh, so many things.
There's so many things.
And we're almost out of time,
Yeah.
but what would you like to leave our viewers with today about this important subject with Medicare and as it fits to their overall retirement plan?
Well, we think it's a very important part of retirement. Your health costs are one of the top 3 costs that you're going to face in retirement, and we believe that you need to do it in the most efficient manner possible. So if you'd like for us to take a look at your overall situation and see how this Medicare piece fits in, and not just make a call to an 800 number to determine what's best for you, we'd love to have you come into our office and help you do that.
Wonderful. Mark, Dale, thank you so much. Thank you for your passion in desiring to serve folks in Central Arkansas and really help them navigate through this maze that can be Medicare and all things retirement. We appreciate you watching. We encourage you, call the number on the bottom of your screen, 866-724-3893, to get your complimentary appointment with Dale and Mark and Retire Path Wealth. Thanks for watching. We'll see you next time.